Hey everyone, welcome back for another deep dive. Today we're going to be looking at wearable health monitors.
Ooh, very timely.
Yeah, and we like to go in depth here, so
Absolutely.
we've got some excerpts from a paper by Jörg-Owe. It's really fascinating stuff. He goes through the history, the potential benefits, some of the challenges of this tech.
Yeah, I think one of the most fascinating things about wearables is just how rapid the innovation has been.
Yeah, I mean, you think back just a couple decades ago, those big clunky heart rate monitors were like
Oh, yeah.
the cutting edge.
Chest straps, yeah.
Now we've got microscopic sensors in these sleek wristwatches tracking all sorts of things. Schnepp even mentions blood oxygen levels and things.
Yeah, and it's amazing what they're able to track now with these tiny little sensors. Like you said, everything from your heart's electrical activity to your blood oxygen levels. It's really incredible.
So how did we go from those 80s workout video, heart rate monitors to these tiny marvels of technology? What happened?
Mm-hmm. Well, Schnepp really points to miniaturization as a key driver. The sensors are they're microscopic now, but they're so powerful. And of course, the battery technology has improved dramatically.
Yeah.
And wireless communication, you don't want to be tethered to a wall socket all the time with your health monitor.
That's right. Nobody wants that.
So those were really critical advancements.
It's funny how things that we take for granted now, those advancements,
Yeah.
That was revolutionary. That really helped propel the field forward.
Absolutely.
Schnepp also talks about the COVID-19 pandemic. How do you think that played into things?
Well, the pandemic really highlighted the need for remote healthcare solutions, and wearables were kind of thrust into the spotlight. They offered a way to monitor patients outside of the traditional clinical settings.
Yeah, and I wonder if it would have been as rapid of an adoption if we hadn't had that global crisis sort of pushing us in that direction.
It's hard to say, but it definitely seems like it accelerated things.
Yeah, fascinating to see how a crisis can drive innovation like that. But speaking of innovation, I mean, the variety of devices available now is just mind-boggling.
It really is. It's not just about tracking steps anymore. We have everything from those fitness trackers that motivate us to move more to medical-grade devices that are literally saving lives.
Yeah, there's so much out there, and Schnepp even mentions things like microfluidic patches, which I have to admit, I don't even know what that is.
Yeah, sounds pretty futuristic. But basically, they're these tiny wearable patches that use microfluidics, microscopic channels of fluid to analyze your blood or your sweat for specific biomarkers. And Schnepp talks about how they can be used for continuous glucose monitoring.
Oh, wow.
For people with diabetes, so they don't have to prick their fingers all the time. But that's just the beginning. Researchers are looking at them for monitoring everything from your hormone levels to even detecting early signs of infection. It's incredible.
So it seems like we're really moving towards a future of like personalized preventative healthcare in a way that we couldn't have imagined even a few years ago.
Absolutely. Yeah, it's very exciting.
So let's talk about some of the key players in this field, the companies that are really pushing the boundaries. What are some of the things that Schnepp highlights?
Well, he talks about the landscape being very diverse. You've got your familiar fitness trackers like Fitbit and Garmin. They're all about motivating us to get those steps in, to get more active.
Right.
And then you have, smartwatches like the Apple Watch and the Samsung Galaxy Watch, which really have evolved way beyond just telling time. You can get ECGs on them now to monitor your heart rhythm. You can get blood oxygen level measurements. They even have fall detection for seniors. It's pretty incredible how much technology they're packing into those little devices.
It's amazing. And then for people with certain health conditions, you've got more specialized devices like the Dexcom G6, which is for continuous glucose monitoring, or the Zio patch, which is continuous heart rhythm monitoring.
Right, exactly. And Schnepp really emphasizes how these wearables are changing the way people manage these conditions. It's really giving them more control and more insight into their own health.
So what makes these devices so powerful? I mean, beyond just the fact that they're tracking all this data, what are some of the key features that really make them stand out?
Well, Schnepp talks a lot about continuous monitoring.
And that seems pretty self-explanatory, but why is that such a game changer?
Well, instead of just relying on occasional checkups or waiting until you feel unwell, you have this constant stream of information about your health. So you can really get those real-time insights and potentially, intervene early on if something's not right.
So, like, let's say hypothetically, your smartwatch notices that you're having an irregular heartbeat during a particularly stressful meeting.
Exactly.
That could be a sign of something serious that you might not have even noticed otherwise.
Right? It's like an early warning system for your health.
And with all these advancements in sensor technology and data analysis, I mean, these devices are only getting more sophisticated in terms of what they can detect.
Oh, absolutely. Yeah. It's incredible how sensitive they're becoming.
But it's not just about collecting data, it's about making sense of it, right? Schneppat talks about data integration and companies like Vital that are working to create this kind of unified platform for all this health information. What do you think about that?
Well, I think it's a really important piece of the puzzle. Imagine having all your health data from all your different devices and apps all in one place. No more siloed health data. It's about having that holistic view of your health.
So instead of having your step tracker app and then your sleep app and your blood sugar app and everything, you have one dashboard that's showing you everything together.
Exactly.
Yeah.
And as Schneppat points out, you can really use that integrated data to generate personalized insights and interventions. It's not just about the raw data, it's about what you do with it.
So give me an example. Like, how could that actually play out in real life?
Well, let's say your wearable is tracking your heart rate while you sleep. And over time, it notices that your heart rate is elevated during certain sleep stages.
Okay.
So that could help you identify factors that are disrupting your sleep, and then it could give you personalized recommendations for how to improve your sleep quality. So, it's about using the technology to empower you to take control of your health.
So it's not just numbers on a graph. It's actually understanding what those numbers mean for you and what you can do to change them.
Exactly.
That's really powerful. But, Schneppat also emphasizes the importance of user-friendliness.
Oh, absolutely, yeah.
These devices need to be easy to use. They have to fit into our lives seamlessly,
Right, because what good is a super advanced health monitor if you can't even figure out how to use it or if it's a pain to use? It has to be intuitive. It has to be accessible so people actually want to use it.
Yeah, nobody wants to be, fighting with their technology all the time.
Yeah, we're talking about drop-in widgets, integration with health systems, things that make it just a natural part of your routine rather than a chore.
So you're more likely to stick with it if it's easy and enjoyable to use.
Exactly, yeah. That's the key.
Okay, so we've talked about the evolution of wearable health monitors.
Yeah.
This amazing diversity of devices that are out there, some of the key features that make them so powerful. Now I think it's time to really dig into what everybody wants to know, the benefits.
Yeah, let's get to the good stuff.
And Schneppat's research really highlights a lot of really exciting things that are happening in this field.
There really are, and I think one of the most obvious benefits is what Schneppat calls real-time health monitoring. It's about having that constant access to your health metrics. Understanding trends, monitoring your progress towards your wellness goals. It's like having a 24/7 check on your well-being.
So it's not just about how you feel in the moment. You actually have concrete data to back it up.
Right. And you can see your progress over time. You can see how your lifestyle changes are impacting your health. It's incredibly valuable, especially for people who are managing chronic diseases.
Yeah.
Schneppat talks about how wearables are really changing the game for things like diabetes, heart disease, even sleep disorders. You can use them for remote monitoring, keep tabs on how things are going without having to go in for constant checkups.
Yeah, that's got to be a big win for both patients and doctors. Less time in the waiting room.
Absolutely.
More personalized care.
Yeah.
Everybody wins.
Yeah. And Schneppat points to studies that show how these devices are impacting people's self-management strategies. People are taking a more active role in their health. They're tracking their progress, making adjustments as needed. It's really empowering.
Hey, what was it that surprised you the most about, how people are using these devices?
I think I was most struck by the sense of empowerment that people reported. Schneppat highlights some studies where participants really felt like they were more in control of their health. They felt more motivated to stick to their treatment plans. They were just generally more optimistic about their well-being. I mean, who wouldn't want that?
Yeah, it's so encouraging to hear that, it's not just about monitoring, but it's about actually giving people the tools to take control of their own health.
Absolutely. It's about putting the power back in the hands of the patient.
Yeah. And that empowerment seems to translate into real-world results, too. Schneppat talks about studies that link wearable tech to improved quality of life for people with chronic conditions.
It's amazing, right?
Even a reduction in healthcare service utilization, like fewer hospital readmissions.
That's a big deal.
Yeah. So it's not just managing symptoms, it's actually having a tangible impact on people's lives.
It's about improving their lives overall.
Yeah, but Schneppat does talk about the challenges of what he calls multimorbidity. People who are dealing with multiple chronic conditions.
Right. And that's where wearables can really make a huge difference. Imagine you're trying to manage multiple conditions. You have to keep track of all your different medications, your appointments. You're constantly feeling overwhelmed. It's a lot to handle.
Yeah, I can see how that would be incredibly challenging.
Absolutely. And Schneppat suggests that wearables can be a real lifeline for these individuals. They can help them navigate the complexities of having all these different conditions. Collect data from various sources, give you that holistic view of your health, make it easier to spot potential problems and coordinate care.
Yeah, it's like having a personal health assistant.
Yeah.
Helping you stay on top of everything.
Exactly.
Okay, but Schneppat does acknowledge that the evidence on clinical outcomes using wearables, it's kind of mixed, right?
He does. A lot of studies show really positive results, especially when it comes to self-management and quality of life. But some studies, they show neutral or even weak negative effects.
And Schneppat really dives into why that might be.
Yeah, he talks about variations in study design, the size of the studies, the specific conditions that they're looking at. There are a lot of factors that can influence the outcome.
So this concern that sometimes the data is not accurate, how big of a problem is that really? Are we talking about, minor inaccuracies, or are there cases where these devices could lead to a misdiagnosis?
Well, that's a really important question, and it's something that researchers are definitely looking into. It's still a relatively new field, so we're learning as we go.
Yeah.
And we have to remember that no technology is perfect.
Right.
There are going to be some inaccuracies, but the potential for misdiagnosis, that's a serious concern, and it has to be addressed. Schneppat really stresses the importance of continued research, making sure these devices are really providing accurate, reliable information. That's crucial.
Yeah, it's like any tool, we need to understand its limitations and use it responsibly.
Okay.
But let's not get bogged down in the challenges.
Okay.
Schneppat does paint a pretty exciting picture of what the future could look like.
It's hard not to get excited about it.
Yeah. What are some of the things that he sees happening down the road?
Well, he talks about even greater impact on chronic disease management through personalized care strategies. Imagine a world where your wearable data is being used to create a treatment plan that's tailored specifically to you.
So you maximize your chances of success, you minimize the risk of complications.
Exactly. It's about being proactive, not reactive, using data to manage your health and prevent problems before they even start.
Yeah, that's the dream. And Schneppat talks about the fact that we're seeing this trend towards these data-driven, individualized care models.
It's happening right now.
So wearables are really poised to play a major role in this healthcare revolution.
It's inevitable. They're perfectly suited for it.
So we've gone from those clunky chest strap heart rate monitors to these tiny AI-powered devices that are transforming healthcare.
It's remarkable.
It's a pretty incredible journey, and it seems like we're really just scratching the surface of what's possible.
Absolutely. The future's wide open.
It is. It's really exciting. So much potential there. But before we get too carried away thinking about the future, let's take a step back and just think about what we've learned today. After this deep dive into the world of wearable health monitors, what stands out to you the most? What are you most excited about? Or maybe even skeptical about?
I think what really gets me is how these devices could change the whole patient-doctor relationship.
Oh, interesting.
You think about it, your doctor could have access to weeks, months, years of your health data, all thanks to your wearable. I mean, that's incredible.
Yeah.
Think about how that could personalize your care, intervene early, and really understand those long-term trends that you might miss in a quick office visit.
Yeah, it's like going from a snapshot of your health to a full-length documentary.
Exactly.
Yeah.
And like Schneppat keeps saying, we're moving towards a more data-driven, individualized model of care.
Right, and wearables are right at the forefront of that.
They are, but all of this data also raises some big questions, If we're generating all this data, who owns it? Who has access to it? How do we make sure it's used ethically?
Right. We can't just focus on the cool, shiny benefits.
Yeah.
And forget about the potential downsides.
Exactly.
Think about it. These devices are collecting really sensitive information.
Yeah.
Your location, your sleep patterns, even your stress levels.
Yeah.
Schneppat even mentions concerns about how insurance companies or employers might use this data.
Yeah, it's a valid concern. And, we do have regulations like GDPR and IPA that are supposed to protect our health information. But with all this new tech, we really need to be constantly evaluating those safeguards, making sure they're keeping up.
Right, and making sure that we as individuals have a say in how our data is used. That's a conversation we need to keep having. Okay, so as we wrap up this deep dive, I want to leave our listeners with one final thought-provoking question. Given everything we've talked about, all the advancements, the benefits, the challenges, how do you envision wearables shaping the future of healthcare?
Wow, that's a tough one. I think we'll see wearables becoming even more integrated into mainstream healthcare.
Okay.
They'll go from being these personal tracking devices to being essential tools for diagnosis, for treatment, even preventing disease. What if your wearable could detect a health problem before you even had any symptoms?
Yeah, that's amazing, but also a little bit scary, right?
It is. It's a powerful technology.
Yeah. I think it's really up to all of us to make sure this technology is used responsibly, ethically, and benefits everyone.
I agree. It's a collective responsibility.
Well, this has been an incredible conversation. Thank you so much for sharing your insights with us.
My pleasure. It's been fun.
And to all of you listening out there, keep exploring, keep asking questions, and keep those conversations going. The future of healthcare, it's in our hands, and the more we learn and discuss, the better equipped we'll be to shape a future we can all be excited about. So thank you for joining us for another deep dive. We'll be back again soon with another fascinating topic.